I invite our founding director, Professor Zul Merali, to share a few words, opening remarks, and then we'll start the session. Thank you, Zul. Please go ahead.
Thank you very much, Candy. Thank you very much, panelists. And most important, thank you very much for all from around the world that are tuning in to actually participate in our webinar. And it's I think for the World Health Day, this is really an important topic, very important, because I often say that when brain doesn't work well, nothing else matters. It really, everything that you see, that you feel, that you do is entirely orchestrated by your brain, the functioning of your brain. And so it is a very powerful and a very precious organ that we are all gifted with. And I think that it is so important that we look after its health like we look after our bodily health. We are very much into diets, into exercise, into all kinds of things to look at our physiological health. We should not forget that the brain is at the core of it, and that we should be nourishing in many different ways the health of this organ, the brain, a 3-pound organ in between your ears that is so critically important to all of us in everyday functioning. As a matter of fact, just yesterday we had a UN session, a technical expert group looking at the brain capital of why is it important to invest in brain health, so that it would then impact on physical health, it would impact on economic health, it would impact on psychological health, it would impact on community health and world health, essentially. So our vision at the Brain and Mind Institute is a healthy brain, healthy world. And so today's topic is very, very important. And I think that I'm so delighted with the experts that we have at the panel here today. They're passionate, they are engaging, they are very dedicated to actually finding ways of making our brains more resilient. And I think that over the next decade, this theme of resilience and brain resilience is going to be like one of the more important topics that you will hear about. And it is because now we're recognizing that how important the brain is, not only for yourself, but for your communities, for your economies, for your countries, and globally. So welcome all. I think we have participants from all over the world, and I'm at the end will tell you where all the participants were from. But with that, I would like to kind of launch this series today. Just one more word about the Brain and Mind Institute. As you know, it is a young institute at the Aga Khan University, and its main core mandate is to focus on brain health and mental health. And so I think it couldn't be a more appropriate topic for the launch of the Brain Health Day. So with that, I will pass it back to Dr. Candy Machungi.
Thank you so much, Zul. And I think without further ado, I will introduce our moderator for today. Our moderator for today's session is Dr. Karen Blackmon, who's a consultant neuropsychologist here at the Brain and Mind Institute, who's dedicated to improving global neurological health through culturally appropriate neuropsychological assessments and interventions. And I'm sure she'll be able to share a lot more, because in this session, she's taking a dual role. She's a moderator, but also a panelist, and will be sharing a lot of her insights into some of the work, pertinent, impactful work that we're doing here at the Brain and Mind Institute. Over to you, Karen.
Thank you, Kendi. I'm happy to be here. Karibuni to everyone in the audience. And I'd like to introduce the other panelists. So we'll go through each one. Dr. Chi Ude Momo is my close collaborator, friend, colleague, neuroscientist, and someone who is really putting Kenya, Africa, South Asia on the map in terms of neuroscience of aging and dementia. Dr. Chi, as we all call her, is able to talk meaningfully about cells all the way up to human behavior. She studies multiple levels of the nervous system, our brains, and she's an expert in brain functioning. She's done amazing work across the world to bring attention and advocacy that will help people not only age better, care for their loved ones who may be suffering from dementia. So we're very excited to have Dr. Chi with us today. And I'll move on to the next panelist. Welcome, Dr. Chi. Dr. Mansoor Saleh is my esteemed colleague and friend and co-investigator, co-principal investigator on studies looking at the resiliency of the brain after cancer. Dr. Saleh has been the founding director of the Cancer Center, the Department of Hematology and Oncology at Aga Khan University. And he's bringing cutting-edge care to patients living with cancer. And Dr. Saleh is not only saving the lives of people, but he's making sure that after they are surviving, they're thriving. So living well with cancer. He attends to patients' emotional, cognitive, and behavioral needs after cancer diagnosis and life after cancer. So thank you, Dr. Saleh, for being here with us today. And we're very happy to welcome Christine Mungai, who's with us, talking about her experience as a caregiver to her mother, who is living with dementia. So it's a very important perspective that we all need to hear about what it's like to live with someone who has dementia, care for someone, and still care for oneself. So it's an important perspective, and we're very happy to have you here. Your experience in advocacy is an asset on our panel. So moving into the panel discussion, we're going to start with a question for Dr. Chi. And again, just to remind everyone, we welcome your questions and we'll have a question and answer session at the end. Dr. Chi, I'll ask you a question, but first, let me just give you the chance to introduce yourself and anything else I may have forgotten that's important for the audience to know.
To be honest, I've done several talks, and that's the best introduction I've ever received. So thank you very, very much, Dr. Blackman, or Karen, as I fondly call my work sister friend. It's a real pleasure to be here. I don't think I can add any more, other than to say that I am absolutely passionate about not just the brain health, but more importantly, about addressing brain health inequities. That are quite prevalent when you look at the disparities between high income and low income settings. So a lot of my responses will kind of be centered around this concept of addressing brain health inequity by shining the light on some of the amazing work that's being done in Africa, but also the amazing resources that are being generated from Africa around promoting brain health. So I'm ready for your question.
Can you talk to us a little bit about what we mean by brain resilience? And why is that so crucial for our mental and emotional health?
Yeah, no, absolutely. So one thing that struck me, first of all, is so one of the signs that you see when you're leaving the Jomo Kenyatta International Airport in Nairobi. I like to mention this because it's just something that you take away from the country, and it says very clearly, if you're going to take one thing away from Kenya, let it be the spirit of resilience. And one might ask, well, what is resilience, right, in the first place? So, at least in the context of cognitive aging and brain aging, several researchers over the years have really disputed the actual meaning of resiliency. And back in 2018, and I will share this in the chat, we published a white paper that really started to define what we mean by brain and cognitive resiliency and how it impacts health and overall function. So brain resilience or cognitive resilience, we think it's the brain capacity to cope with challenges and diseases like dementia. But I want to take a step forward, another step forward is when we think about resiliency, at least in the African context, we think about it in the context of flourishing. Flourishing. And so it's essentially what I mean is, so we think that it's not just the brain's ability to cope with disease or pathologic burden, but also to flourish in the face of these sort of challenges. And resiliency is really crucial because it enables the brain to adapt and also recover from stresses, for example, but also the burden of pathology that we see in diseases like dementia. And we know that a resilient brain can better manage daily challenges and also, of course, reduce the impact of mental health disorders and still maintain cognitive function over time. But resiliency is shaped by many factors, and I think we see this a lot in low middle income settings. So, for example, culturally, traditions like storytelling, for instance, and communal living, along with active roles of engaging with communities, engaging with your elders, the support that we get from our family units, we think that they're very important for promoting brain health. So, socially, we see these strong family and community networks allowing promoting mental stimulation, reducing stress and boosting resiliency. But I think it's also important to mention the economic angle here, because we know that stable income and employment provide resources for health, for education, for access to healthcare. And if you have access to healthcare, if you have better nutrition, you're more likely to have factors that will then, we call them, act as proxies of cognitive reserve that promote brain resiliency. So I think promoting brain resiliency and enhancing this helps to preserve your mental health. It helps to improve quality of life and prevent or delay cognitive impairment and decline, especially in aging populations. And we're actually seeking to study this quite empirically in several of our studies at the Imarisha Brain Health and Aging Center that Dr. Blackman and I co-direct. And some examples of this include our Brain Resilience Kenya project with Dr. Saleh as one of the co-principal investigators. And here we also have the Africa Fingers project. And in these studies, we're trying to identify determinants of resilient aging, but also develop more contextual and culturally appropriate tools and strategies to boost resiliency. And we'll be speaking a little bit more about this work during this session.
Dr. Chi, thank you for introducing that work. And I'll just pull out a couple of key points for the audience and what you've said that I really hope we can take home with us. One is about the plasticity of the brain, the ability to change the brain, and that social connections are so important for brain health. But coming back to the idea of change, that resiliency is about being able to change the brain so that we can improve it over time and preserve our functions, even after, let's say, injury in the brain. So we know how important change is, and we know how important hope is, that we have to believe, then change, to have a sense of hope, right? When difficult things happen, like a diagnosis of dementia in a loved one. So I'd like to transition now to Christine, who has probably had to maintain a sense of hope and belief in change and things, and seeing the positive side of even a difficult situation like living and caring for someone with dementia. So Christine, can you talk to us a little bit more about your story, caring for your mother, and how you've maintained a sense of hope and change and resiliency in your caregiving?
Thank you so much, Karen. Hello, everybody. So maybe I'll just start by maybe giving a background. So it's been 15 years since my mom was diagnosed with dementia. She was diagnosed when she was 50. And I know dementia is something that is mostly attributed to people who are a bit older. So yeah, so it was quite a blow for us as a family when she was diagnosed, because 50 is meant to be a second blooming, but for her it was an appending. And that's when we got into the care journey. And that's when also I found myself to be a sudden caregiver to her, coming into something where I have no clue on what is expected of me or what to do. But now, 15 years later, in hindsight, it's something that you kind of start to see that nobody's ever truly prepared for, unless like you're a professional caregiver, especially if you're family caregiver, because you find yourself thrust into it. And at the same time, there's a lot going on. On one hand, you're trying to understand the condition and how to take care of the person. On the other hand, your emotions are unraveling because you are gradually watching someone you love lose their cognitive functions slowly. So there's a lot that was going on at that time. So in those 15 years, well, we've been through a lot. There've been a lot of ups and downs. There've been good moments, and there've been moments where things have been difficult. But I'd say that at the onset, I was really focused on, understanding what my mom was going through and how to take care of her, that unknowingly I neglected to deal with how I was feeling, because I was really just focused on caring for her. But as soon I'd get to know that whatever I was doing wasn't right, because I remember a friend who's also a caregiver, and she's like a mother to me, invited me to accompany her to a visit. There were some ladies who had arranged a visit to go visit their former high school principal who had dementia. It so happened this principal had such a big impact in their lives that they wanted to go for a visit, and she invited me to come along. But a few days prior, she kept asking me whether I'm okay to come visit, and I'm like, yeah, what's the big deal? It's just a visit. I'm okay to come visit. Anyway, so when I got there, and as soon as we got to our home and we turned the corner, and I turned the corner to get into her house, she was in my line of vision, and she was just seated there on a wheelchair and just slumped and immobile. And for whatever reason, I cannot even state it today, it broke me. I just started crying. This is someone I have met for the first time. I do not know them. And I could not hold back my tears. And so I cried. I cried so much. And I also started feeling weird. I'm crying because everybody's looking at me like, why are you crying? You don't even know her. So I really, really cried so much. And I don't know, sometimes to think of it as like maybe I entered the house and I saw the future, maybe. Because at that time, my mom was still a bit lucid. She was walking and talking. But as we speak right now, she is now immobile too. I think this was the turning point in my life when I realized the fragility of my mental state and the rawness of my emotions. All those things that I hadn't been taking care of, like, were really much in the surface, and just a little prick could make me break down. Because up to that point, outside of work, my life was 100% revolving around my mom and everything caregiving. I was part of a support group, part of the activities in the support group, part of the people arranging it. But that wasn't necessarily taking care of me. It was just keeping me so busy to take care of me. So that's the point where I started putting a little bit more of effort in, taking care of me, realizing that I was not okay. And one of the things that I had to actually uh, take into account is that I needed to ask for help. Like, I could not do it by myself, and also speak more about what I was going through. Let people in and tell them that this is what is going on. And when I wasn't feeling okay, to make sure I told them I was okay, and also try to start getting it back into life a little bit, like the things that I loved doing, like just having dates with friends, going back into the gym, or writing, because I do enjoy that, or even just just spending my time just doing something that will give me a bit of pleasure. And also another realization, I feel like, in the beginning of caregiving, sometimes you feel a sense of guilt when you tend to do something that you enjoy, but then you have to it is okay to do something that you enjoy, even if the person you're caring for is not there with you. It doesn't mean you love them any less. So after starting to do a little bit of that, starting to, go back to like life was normal a little bit, I saw how it helped me become even a better caregiver to my mother because I wasn't like always stressing about what needs to be done for her. So for me is keeping that mental vigilance, right? Because even as the condition progresses, you get into a new stage in her condition, which is unfamiliar territory. All of a sudden, you find yourself being sucked into it a little bit. So you have to be totally vigilant that each time you check in on yourself, and even when people ask you, are you okay? Use it as a marker to check in on yourself to make sure that you're keeping your mental state okay. And if you do it as a practice, eventually you're able to be in a space where you are totally not stressed about what you were doing. It's more like the serenity prayer, understanding the things that you can do and the things you can't do, and just have accepting that the things that are outside your control and the things that are within your control, and just working on the things that are within your control. So for me, actually, so I'd say in conclusion, like really, yes, getting back into life a little bit is a way that has really helped me, like to have a life outside my life that is also very important to me, and to do the activities that I love. And again, participating in support groups still is something that is very important to me. So those are the things that just help me stay balanced and help me become a better caregiver to my mother. I hope I did answer your question.
Thank you, Christine. It did more than that. It really grounded us in the reality of what it's like to watch a loved one change over time. And I hear in what you're saying that there's really a grieving process that happens when you see the image of who you know, who you've always loved, that representation of them in your mind change, and you recognize that that person may not be the same, and that's really challenging, and it does something to us to experience grief. But what I hear you saying is that when you check in with yourself and you know what that is, you can have more of an ability to recognize, accept the change, and still maintain a sense of hope through your caregiving groups, through your social connections, so that you're not constantly in a state of grief, but you allow yourself to feel it, to really feel it and move on. And that's a really important concept. Acceptance of hardship and being able to move through it and know that it will pass, that it will change. And we see that happening right in the political climate. There is always the potential for change, but we have to recognize and accept where we're at and be given the tools to move forward. So acceptance and change, that's the balance. And the question for me was, in the panel questions was, what's the relationship between our emotions and our brain? And I think that's at the heart of it, that our emotions are a full body phenomenon, but our brains really help us attend to what's happening. And most of us don't even know what state we're in, right? We're walking, you say, oh, I went from 0 to 10 in a matter of seconds, or you say to a loved one, you get angry so quickly, or you go into a panic so quickly. But the truth is, usually people are walking around at a 9 or a 10 and they don't even realize it. Or they're walking around and they're already so stressed or already in a state of sadness that it doesn't take much to bring them to a 10. So it's important to know where you are, to feel where you are, so that you can change where you are in your mental state. And that takes time and practice and social connections to help reflect. It seems like you're feeling sad and you didn't even realize it, or seems like you're a bit more tense than usual. What's going on with you? And then you check in and you say, I didn't realize I was gritting my teeth. right? So that it's bidirectional. Our emotions influence our brain, and our brain and our actions influence our emotions. So we can act by knowing what we need in the moment, right? Reaching out to people. If we need to do slow breathing, if we need more sleep, if we need to go out and run until we feel like we break our state, until we change our state, whatever it takes to move through a difficult emotion to the other side. Dr. Saleh works with people where he is constantly in a state of giving challenging news, a cancer diagnosis, and helping people cope not only with that diagnosis, but changes in them and themselves and their family units as they go through treatment. And Dr. Saleh is someone who attends to that, which must not be easy, right, with so many patients. So how do you do that? How do you attend to the patient's emotional needs after cancer? How do you describe to them the changes they could experience and the treatment and help them cope with that?
So Karen, thanks. That's a good question. So I should begin with saying there's a storybook called Siddhartha, which says one can never predict what lies beyond the river bend. And as Christine was telling her story, I can imagine that no one would realize and know what is beyond the river bend. It's just a river flowing down, and you may not be able to influence what is on the other side. And cancer is really one of those things. On one day you're healthy, the next day you come, you've got a lump in the breast or in the lung, get a diagnosis, a biopsy, and there you have it. It's a life-defining moment. And it is fair to say that one of the reasons I like to be part of the BMI umbrella, as Zul calls it, is because we oncologists focus on drug therapy, curative intent. We often forget the human being in total. So we here, together with Zul and the team at Princess Margaret, started to assess the mental distress of our cancer patients, looking at a program called Distress Assessment Response Tool. And we started this about 3 months ago. And every patient who's been DARTed, because we call the program DART, Distress Assessment Response Tool, weeps when they are asked questions about their life. Well, I, the oncologist, when they see me, I look at the CAT scan, the blood counts, toxicity, I go on. Although I was trained holistically, our focus has become very narrowed. So the point you ask is, and I think the point that Karen, she makes in this study that we're doing collectively is, when you study patients across the continuum of life and the stresses they feel and they experience, and you assess Fitbit, MRI, biomarkers, psychological testing, we have inserted cancer as a stressor, as a biologic stressor that you did not ask for. And we are assessing the likelihood of a patient as they go through this continuum as to what makes them frail, what makes them resilient. And I think it is fair to say that the program we have here at AKU, the drug called Hope, the research we do in terms of, and what I tell my patients all the time, I cannot feel your pain, I cannot walk in your shoes, but know that we will walk along with you. And what we have today was not present there before yesterday. And the longer you live, day after tomorrow, we'll have a new drug called Hope. So I think the notion that you've talked about all along of hope is preeminent in my life as an oncologist, even though as I go through with my patient, giving them treatment, surgery, chemotherapy, radiation, which is all toxic, making life unbearable sometimes. But knowing that tomorrow may be a different day, and then beyond the river bend, there may well be a better day. So I think part of the work we do is trying to learn from BMI to be holistic in our approach in taking care of patients above and beyond the therapeutic intent, which is noble in itself, but may not always approach the patient in a holistic way.
Thank you, Dr. Saleh. I mean, you're talking about recognizing those emotions, and I think a lot of doctors they don't recognize or actually care for the whole spectrum of the experience that patients go through. So we really respect and appreciate your ability to do that and care for your patients. And Christine, again, coming back to you, because we have a question about how you do that, meaning you you talked about your mom, and now she's in more of the advanced stage. And, it's really hard to think about brain health in someone whose brain health is declining. But all along, you've had to keep your mother as vital as possible for as long as possible. So how have you done that? What strategies have you used to keep your mother vital, even in the context of decline?
Oh, thank you so much, Karen. That's a great question. Yes, right now she's very advanced, but over time, one thing that I found the most important and what I can stress more about is inclusion, right? So I know I know when somebody has dementia, they're very unpredictable in how they're going to maybe behave or what they're going to do, what they're going to say. And I know like the initial feeling is to keep them apart from everybody else, right? Um, uh, but one of the things that I think is most important is to include them in everything that you do, despite how hard it is, despite how many stares you're going to get, despite how many whispers they're going to be, because as much as there's those stares and whispers, there's somebody else being encouraged by seeing what you're doing. And I'd like to say that this actually I learned from a book I read this in the beginning when I was still trying to understand the condition my mom was having. It was actually written, I think, by a neurologist who had a stroke. It's called A Stroke of Insight. I think The Stroke of Insight. And she was just recounting that the time she had the stroke and could not communicate, and doctors and people would come around to her, she would see, feel, and hear everything. And so later now she was saying how we need to she had this insight that you cannot discount somebody just because they cannot maybe express to you how they feel. And now taking that into account, it's like even though my mom probably could not communicate as well, I tended to include her everywhere I went. If we had family gatherings, we'd go together. Anything we did, we would do together. I remember there's a time in the beginning, because my mom was very religious, I used to take her to church because I thought that's what she would have wanted to do before we eventually stopped going. So it so happened when I used to go to church, there's a lady who used to observe me. I don't know her. So we met up, we coincidentally attended the same wedding, and she came up to me and introduced herself and started telling me that she admires the way I take care of my mom. She felt so encouraged. I do not know this lady. She had very good things to say. And at that moment, I felt that in one way or another, unknowingly, I did impact her life, because I didn't know what she was going through, and probably by just seeing what we were doing, encouraged her to do better. So yes, including my mom has been a big part. Like my friends now have become advocates. They understand the condition. My relatives, her siblings, in the beginning they used to come visit and cry a lot, but now they are their own advocates in small groups, because whether my friends are visiting and my mom is there, she will not be removed. She will be part of the visit. It doesn't matter, because people take away something. They learn something either by observing or even by just asking questions, and also including them enhances them socially, because we are social beings. Sometimes even us who are cognitive, we can be part of a social setting. We don't want to participate verbally, but we're just happy to be seated there quietly and listening and feel the whole social effect around us. So that was one way that I really maintained her, I suppose, her mental, I supported her mentally. Right now that she has totally declined, we still encourage a lot of visits. I know one of the concerns I remember was some friends who were saying, what should we do now that she can't speak? Like she won't respond. Like they were struggling on how then they would relate us. Like, it's okay, you can just come, have a conversation, even talk to her, even if she's not going to respond. Just include her, have your own conversation, whatever you're going to do. Just have a visit, even if you don't get a response, and it's still fine. So So it doesn't mean that now that she can't respond, then nobody should see her or talk to her. So I'd say inclusion is the best, because I want to believe, as the doctor in the Stroke of Insight wrote, that somewhere in her senses she is feeling this, what can I say, being part of life and not being excluded from it.
That's what we say. Connections on the outside build connections on the inside, meaning connections in our brain. That we actually recruit more brain when we are in social settings, right? When we exercise together, when we study together, when we support each other, we bring more brain to the task, right? So we know social isolation is a risk factor for age-related brain decline. And social connections are a protective factor, right? Other risk factors that we'll hear more about from Dr. Chi include things that we may not have known 20, 30 years ago, like hypertension. So high blood pressure and diabetes are major risk factors for brain health decline. And you as a caregiver, you probably learned a lot about what drives dementia, and then you say, well, let me take care of that starting now in middle life or even earlier. And Dr. Chi, can you tell us a little bit more about that, the importance of treating hypertension, diabetes, and other chronic conditions to actually protect our brain resiliency?
Absolutely, Karen. I wanted to, first of all, just really acknowledge and thank Christine for sharing so empathically, her story. Before going on into the, management of chronic illnesses, Christine, I want to say that what you said, your story really struck a huge chord, because from some of our research, we're seeing, and this is in over 7,000 people of African ancestry, we actually find that social engagement is one of the most significant predictors of incident dementia. So people who will develop Alzheimer's disease later on. And so, of course, at least for the African context, loneliness is quite an important risk factor, and it needs to be addressed. And I really like how Dr. Blackman really put it, because absolutely outside connections really do build and involve those inside connections. But aside from these sort of lifestyle factors like social activity, there are other what we call comorbidities that drive the development of Alzheimer's disease and dementia. And some of them, of course, includes, and some common ones, I would say, at least for people of African, but also South Asian ancestry, include hypertension, diabetes, and general cardiovascular disease. And incidentally, at least this is data from the UK, I think they surveyed, the UK Biobank is over 300,000 individuals in the UK, and they surveyed people who are Black British, but also of South Asian heritage, and they found commonalities in these risk factors. So we know that people, at least in the diasporic regions, people who are of African and of South Asian heritage are almost 2 times more likely to develop dementia than what is termed in the US, at least, as non-Hispanic whites. So, and what I would call people of European ancestry. And we think that some of the drivers for this is that people of, African and South Asian ancestry tend to have a lot of these chronic diseases, so things like hypertension and diabetes, and they tend to have more of them at the same time in something we call multimorbidity. And so it's really, really important to start to address and reduce, so not just address, but also monitor the development of these chronic illnesses. And even though, like in our studies, we're targeting dementia, I like to say that we're actually trying to target and prevent this multimorbidity, because we know that that will then go on to reduce the risk of dementia. So in our strategies, we don't just monitor whether people will have these disorders, we're planning to actively manage these conditions for our participants. Incidentally, in our research that we've started, we're seeing that people who had previously undiagnosed conditions. As part of our research, we're starting to highlight these factors. And of course, by actively monitoring and helping them manage these conditions, we hope that in some way we can also support them in reducing the risk of dementia. But I think that it's also important to acknowledge that not everyone who has pathology or risk of dementia will go on to develop dementia, because a lot of people think, if I have a family history of stroke, for instance, or family history of hypertension, or even family history of dementia, it's a death sentence, I'm definitely going to have it, but absolutely not. In fact, from the literature on the multimodal, the lifestyle intervention strategies, we actually find that it benefits people who are at greater risk of developing dementia more than people who are at lower risk. And I think that's really encouraging, actually, because it shows that, you have agency over your own outcomes. You can take control of your life by adopting beneficial strategies to reduce dementia risk.
You have agency over your own outcomes, right? That is key, Dr. Chi. That is key. That it's that balance, accepting family history, accepting, some of the challenges that are brought your way, but also change. You can't forget about being actively, an agent in your own change and in the change of your communities. So you don't want to just accept and stay there. You have to change. And so that by that, I mean, go to the doctor and see, are you someone who has hypertension that's not being treated? If you're walking around in a constant state of sadness, is that depression? Do you need to do something about it? Right? So again, coming back to our emotional states and how it influences the brain, many people go for many years not knowing that what their experience actually could be changed. It doesn't have to be a permanent state of depression or sadness or anxiety and threat and fear, that can change. So you have to be proactive in seeking out some support to make those changes, whether that means starting medicine for hypertension, treating your diabetes, or treating depression, which can also be a risk factor for unhealthy aging. So I get this message, over and over again, and we want to turn to Dr. Saleh again, because I know, you have probably so many examples of patients that you've helped make certain changes. Can you give us an anecdote of someone you've seen survive and thrive with cancer, what that looked like, what they did to bolster their resiliency through treatment?
Well, that's a difficult question. Let me go back to what Christine said about inclusivity. When I came to AKU in Nairobi, we had a chemotherapy treatment unit, and we refurbished it, remodeled it. And I come in a day and I saw there were these railings. And I said, what are the railings for? So it's for the curtain so that everybody can have privacy. And I said, where I come from, everybody does not enjoy chemotherapy, but when they do come for chemotherapy, they want to be in a room chit-chatting away. And these railings and the curtains really isolates an individual. I think inclusivity, sharing of experiences within a cancer environment empowers individuals. So that, I think, is very, very important. And I think I've learned something, when I have patients that come in with high blood pressure, I tell them, watch out, you might get hypertension, may lead to a myocardial infarction, etc. Well, the next time I see somebody with hypertension, I say, by the way, take care of your hypertension because it may also help your brain health. So I think we as physicians need to put together all of these paradigms of isolation in our own specialties and make it a holistic message for all. But what you point out is, what are the things, what are the characteristics of my patients who are successful in mitigating frailty that comes in with therapy? And one thing I want you to address, and I see it very often in my patients, is faith. Faith in the belief of an external entity that will help me get through this is a very powerful motivation. It can be the other way around, to say, by the way, how could let God make this happen to me? Now, that's also the con side of it. But I believe faith is very important. And I think the environment in which we live, the support system of the family. So when we recently did a study on distress, it was clear that stigmatization within the environment. So we studied women who had breast cancer before they got treated. So no signs in the external environment that you have breast cancer, just you know. And then we studied women who already had breast cancer, had received chemotherapy, etc. We realized very quickly that stigma, self-perceived stigma, even before the environment knows about it, was a big demotivator, concerned, how will my family react to me, my husband, my children? So I think family support, critical for my patients, and faith, critical for my patients, to go through the journey of cancer and the morbidities we inflict upon them in our efforts to cure them.
All right, so we have quite a few gems of wisdom and insight that we can pull from this about how to improve your brain resiliency. We're hearing about the importance of faith. We're hearing the importance of social connections, of including people, even if they have brain health conditions, in the social world, of making sure you're treating any conditions, chronic conditions that could decrease your brain health. And that could be hypertension, diabetes, or depression, or chronic anxiety, and the wear and tear that can cause on our vascular system that could then lead to decline in brain health. So we're hearing a lot of gems. Physical activity is important. Sleep, we know we need to get good sleep. Every day we reset. Every night we consolidate our memories while we sleep. We start afresh with a good new attitude to change our habits for the better every day. So sleep is important. Anything else that the panelists want to make sure we convey about the brain, the importance of an activity to improve brain health that we may have not mentioned so far before we turn it over to Q&A from the audience?
So Karen, maybe an explicit importance of exercise above and beyond just activity for the heart. And more importantly, the notion of a challenge, be it a word puzzle, be it the New York Times crossword puzzle. What are those things that we believe within scientific environment helps brain connections to be made ahead of time before we might lose some of them through to some morbidity or some illness?
Yes. I like combining dance with cognitive activity. So learning new dances, because you get the physical activity and the cognitive, and it stimulates the brain. When you do it with other people, you get 3: social, physical, cognitive. So I'm a big fan of dancing for brain health. Any other tips from the panel?
Yeah, I do want to mention some additional risk factors that can be modified. And these are low-hanging fruits. So Christine was mentioning about inclusivity. We know that some patients with dementia, we know there's a link to hearing loss and hearing impairment, and of course also sight. So actually, a low-hanging fruit for people who may not be mobile could be actually providing hearing aids. And there is now increasing research on, just provision of hearing aids or improving and boosting, senses can also start to help them engage more with the community and with people all around. And so hearing aids, vision aids, smoking cessation, reducing alcohol intake. Sorry to be the bearer of bad news, but we did a survey. This is in the UK, and almost 70% of the population didn't realize that smoking was linked to, diseases like Alzheimer's disease. So it causes brain loss of the the neurons. So just quitting, or at least reducing, alcohol intake, but also as well as cessation of smoking can actually help to improve the brain. But I think it's really important also to just think about some low hanging fruits, like managing some of your some of the sensory systems, like, you know, your hearing aids, using hearing aids, using glasses so people can see better. There's some critical things that can actually work in the immediate term.
I hope everyone's getting all those because they're important. And the audience members are putting yoga in the chat, badminton, deep breathing. So there's lots of great advice in the chat if you haven't tuned into that already. And Dr. Murali, did you want to add to the?
Yes, I wanted to re-emphasize Chi's point, Dr. Chi's point, in terms of attempting to prevent and promote. And what's very hopeful is that about 40% of dementias can be prevented. So you have a lot of control in your hands, and we're trying to figure out, and yourself as well as Chi, very much involved in trying to figure out what are the modifiable risk factors that are relevant in the context where we live to make a bigger impact. But the end point being that there's a lot of control that we have, and prevention and promotion is huge. And the magnitude of it is only beginning to realize now. And Dr. Chi Udumomo is also leading Fingers Africa project, where that's exactly the intent, is to figure out and test out how can you use certain preventive measures to change the trajectory of whether you're going to develop dementia or not. And in keeping with this, I also wanted to point out that if you look at the logo of the Brain and Mind Institute, a lot of what we've been talking about is encapsulated in there. And you can see little dots in the outline of the brain, and those are connection points. And it is not just connection between the neurons that we talk about, but it is the connections of individuals within the society and connectedness of the societies. And then you also see on our logo a little green leaf that talks about growth mindset, and that signifies resiliency and the strength that the brain has to repair itself and to grow in a way to kind of make it more resilient. So it's very exciting to see everything kind of that we're talking about actually being encapsulated in the logo that we have. That was the intent. So over back to you, Dr. Karen.
Yes, yes. And Christine, we want to give you the chance to give parting advice, parting wisdom.
It's just that when I started this conversation, I realized there's something that I failed to mention on maintaining my mom's brain resilience during the time she was still active. And yes, something important that you mentioned is physical activity. Like that was very important to us. So physical activity and diet. Like one thing that we struggled initially, you find that in the Western world, there are all these activities that have been set out, but they're culturally relevant to the Western world, you know, like bingo, you know, the games they play, coloring and whatnot. And then, but when you come back to our African culture, those do not resonate well because, first of all, you're making them learn something new, and that's not the point where you start learning something new to participate in. So we tried many things, trying to find what she really liked, you know, whether it was gardening or whether it was, you know, okay, we didn't want to do cooking because we wanted really to discourage that, but try to find things she could do. And so we settled on just walks, a simple thing. So for a very long time, for so many years, we used to have regular walks. And it helped in two ways. First of all, keeping her physically and mentally fit, but it also helped her with the fidgetiness and uneasiness they get when they really want to just move around and get going. So that did help. And also the diet, as in, along the way, we learned that the diet affected how she slept, how she felt. Because again, her physical activities is also very much reduced compared to somebody who is working or just involved in day-to-day life. So making sure that you just keep her diet that keeps her optimal, that was also something that really helped. And of course, like you've mentioned, it eventually contributes to how your other health factors are, like your blood pressure or your diabetes level, because they're really susceptible to getting those when they're already in such a condition. So yes, so that is one thing I really just wanted to emphasize on, though you've all talked about it. And yes, physical activity is just like the magic trick in the beginning of things. And later on, when they can move, physiotherapy comes in place.
Christine, thank you for really serving as a role model for how to do caregiving really well. We really appreciate your insights and your wisdom around caregiving, and just want to let everyone know that we'll provide some resources around self-care and caregiving to people in the audience. So turning it back to Dr. Kendi Muchungi to finish us off with a few questions, advice, parting wisdom from Kendi.
Great. Thank you, Karen. I think quickly we'll try and answer some questions from the panel, from the participants. But if possible, we see how we can keep our responses just to the point. So Mansoor, I think one of the questions we feel that you could respond to is how can patients accept their diagnosis and maintain hope for the future simultaneously, and what strategies can help them achieve this balance? And then I'll go to the next person. So over to you, Mansoor.
So I'll make it short. I think the physician has to convey hope above and beyond the numbers of response rate, overall survival that I get from the Zoom links that the patients use. I think the belief that, and the motto of the Cancer Center Clinical Research Unit, I'm quite envious of Zul's great logo in the BMI, but he can't beat us when we have the motto that says the drug called hope. If the physician is able to convey hope, I believe that is an incredible motivator above and beyond the therapies we use.
Amazing. Thank you so much. Christine, what are the most effective ways to support a loved one in emotional distress without overwhelming or alienating them?
Okay, that's a very good question. I may need help, but so one thing maybe I may say is creating and allowing space. I think most of the time when somebody goes through an emotional thing, the first thing you want to do is fix them. And sometimes it's just to create that space where you can allow them to go through what they're going through, where they feel less judged. And then when they kind of calm down, then you can be able maybe to talk about what is happening. But it's just creating, not finding it to be a problem, just allowing them to go through it, and then coming out of it together when they are in a space where they want to talk about what is really causing the distress. And yeah, that's one thing I learned. Just not doing anything is actually doing something sometimes.
Amazing. Sometimes we really want to help, but maybe just being present is all that's necessary. Karen, how can individuals experiencing serious illness effectively manage suicidal thoughts, and what immediate steps should be taken to ensure their mental well-being?
Yes, suicidal thoughts are a reflection of just intense pain, an intense emotional distress, and a desire to make it stop. It's a thought and it passes. That's the most important thing people need to know. But the background state that got people to that point has to change, meaning that it's a time for help, to get support, so that one doesn't find themselves in that situation where the only thing they can think about is ending the pain. So there needs to be support, therapy, so that person can experience some degree of hope again for the future, right? So, but suicidal thoughts, they're not uncommon, they occur, but we don't normally want to act on them. And so when someone says they want to act on it, that is a real moment we have to pay attention and get someone into treatment so that they don't feel that that's the only solution. There is life after distress. There's life after pain. And there are good moments and there's reasons to hope. So we want to encourage people to seek help, talk to peers, loved ones, professionals, if they're experiencing that. You don't have to suffer alone, and it will pass. So just turning it back, because that was a very big question. I hate to rush it at the end, but Kendi, thank you for raising it.
Oh, great. And then, Chi, what are the most effective methods of coping with long-term emotional trauma, and how can individuals begin the healing process?
Yeah, just in the spirit of brevity, I'm just going to start by saying, long-term emotional trauma speaks to kind of like long-term stress, right? And one of the things that you need to think about that causes chronic stress is that feeling that you can't do anything about it, and it's the feeling that you don't have any hope. So I would say that some strategies that can be used to cope with this sort of long-term chronic stressors and chronic stress exposures could be starting to think about adopting routines, for instance, that you find enjoyable. So things like, if you find exercise enjoyable, if trying to improve your sleep quality, if you could engage in mindfulness activities, and some of these activities have been shown to kind of like also help to release endorphins, or happy hormones, that can help you to reduce stress. But it's also, I think we've in this throughout this webinar, we've really talked a lot about the fact that you have to accept how you feel your own feelings, and then you have to kind of have the aptitude to want to change and heal from how you're feeling. But there has to be acceptance, and acceptance that it's fine to feel this stress, but then trying to do something about the stress. And we've talked about several strategies, especially around the physical exercise, but also more importantly, I think, is making sure you're happy to receive support and opening yourself up to receiving support. One thing we didn't really talk about throughout this session was gender differences in how people cope with stress and in how people adapt to stressors. We know that at least in some contexts, especially Africans, and I think in the South Asian cultures, and I think it's globally accepted that men are less likely to seek support, and you know and that's something that needs to be addressed, ensuring that men are comfortable with crying, for example, maybe not crying, but at least comfortable with accessing emotional support as and when needed.
Thank you, guys. I think all those really amazing points. Maybe Zul, I don't know if you can do this as briefly as possible. The abuse of iron supplements, or either too much usage, what are the long-term effects to the brain? And then I think we will kind of wrap this up to the best of our ability. But maybe what I can say now is that we will try and get all the expert panelists to respond to the questions that have not yet been responded to, and send these out as sort of the documentation, the proceedings from this webinar. Zul, over to you.
Thank you, Candy. Yes, I'll keep it very brief, but I'd like to change that question. It is not just about iron supplements. We are bombarded, if you go to the drugstore, for example, all kinds of supplements that claim to be doing wonders for your health, your brain health. And so the word of advice from my perspective would be everything in moderation. Because like any medication, for example, if it can be very useful, but it can also be damaging. It's like a knife. Like you can use it for a positive intent or negative. And so the good safe point is to do things in moderation and do your due diligence. These days, you can find everything on the internet. Do a careful analysis before you go into heavy duty supplements of any sort. But some of them are useful and some of them are not. So with that, I'll pass it over to you, Candy.
And so maybe Zul, over to you just to give the closing remarks, and then we'll call this webinar.
Thank you. Thank you, Candy. Thank you, team, for hosting such a wonderful webinar. It takes a lot of work behind the scenes. And so I want to recognize Candy's work as well as Gloria's work behind the scenes to kind of do this seamlessly. Wanted to, of course, thank our panelists, Christine Mugai, Karen Blackmon, Mansoor Saleh, and Chi Udumomo. It was really wonderful for you to kind of share your insights and spend time with us. We are all very concerned about the brain health, brain resilience. So thank you for shedding so much light on this topic and more, and all the work that goes on at the BMI. Thank you also to Mansoor Saleh, who has been our one of our major partners in the kinds of research that we're doing about looking at the interface between physical health and mental health. And then last but not least, I wanted to say a huge thank you for all the participants that have stuck through the entire webinar. We've had close to about 500 individuals constantly participating in this event. Very, very excited, and we hope that you found this very useful. But also, please, we're open to hearing from you about what other topics you might think might be interesting for you for us to host on your behalf. So please keep in touch. And last but not least, Brain and Mind Institute is a resource for all of us. So please feel free to communicate with us with any of your sort of needs and wants from the Institute. So thank you all.